Hello, and welcome to our debate this week that complementary therapies are covered under the Canada Health Act. My name is Elizabeth Mathers, and I will be arguing in the proposition. As healthcare providers, we are aware of the strain on Canada's healthcare system. These are just a few of the headlines which appear daily on our news feeds. It is obvious that a change to our Healthcare Act and healthcare delivery systems need to be a higher priority for our governmental agencies. In an interview on June 1, 2022, Dr. Adam Kassam, the past president on the Ontario Medical Association, spoke about the need to modernize the Canada Health Act in a response to the changing needs and values of the Canadian healthcare system. Dr. Kassam spoke of the iniquities and the inefficiencies of care, with the result that in Canada we have not provided top quality healthcare for a very long time. In these opening remarks, I have several objectives. I will state the resolution and define key terms and the legislation. Background on the current status of complementary therapies will be provided, and key points for the inclusion of complementary therapies in the CHA, the allocation of scarce resources, and complementary therapies as an evidence-based key component of the biopsychosocial model of healthcare. Under the current mandate of the Canada Health Act, the state of healthcare is at a nadir. The Act, as it is executed, does not sufficiently encompass the realities, necessities, financial strain, and diversities of a growing multicultural nation. The CHA must be reconsidered to reflect the challenges of current and future Canadians. Complementary therapies represent a wide range of therapeutic treatment options subject to provincial and federal regulations, such as the Regulated Health Professionals Act or the Natural Health Products Regulations. These therapies provide adjunct care to promote and restore the physical and mental well-being of Canadians. Given that many complementary therapies are regulated and provide effective healthcare treatment for Canadians, it is incumbent upon the policymakers to recognize their place in the Canada Health Act and remove the financial barriers which restrict access to care. Complementary therapies are covered under the Canada Health Act and should be included in insurable services provided. The CHA is administered by Health Canada, who has the primary responsibility for maintaining and improving the health of Canadians. The objective of the Act is to protect, promote, and restore the physical and mental well-being of residents of Canada and to facilitate reasonable access to health services without financial or other barriers. The CHA is not a prescriptive list of applicable therapies, but rather is restricted to medically necessary hospital and physician services, which allows latitude for each government to choose which services may be provided. An important point to note is that the CHA was enacted to ensure reasonable access to health services without financial barriers. The wholesale exclusion of complementary therapies from broad coverage presents a significant financial accessibility burden to Canadians. In addition to conventional healthcare practices, patients frequently choose to supplement their care with complementary therapies. These therapeutic options are not intended to replace conventional healthcare, but rather to complement medical services. Complementary therapies are wide-ranging, and of these therapies, many are traditional healing techniques in their country of origin. Others are health professions who have developed alongside the medical model. All may provide a patient with some measure of pain relief, a coping mechanism, or an improved quality of life which may improve therapeutic outcomes along with conventional medical care. There pervades a misconception to this day of the complementary therapies as the domain of snake oil salesmen and charlatans offering bogus claims of magical healing to confound and deceive the vulnerable population. However, many complementary therapies are evidence-based, rigorously tested, and have been proven to be more cost-effective and produce better outcomes than current medical interventions. Consider for a moment that surgery was once considered to be barbaric for many centuries. Physicians considered surgery to be beneath them and left this medical intervention to the local barbers. Research and evidence folded surgery into the medical field, where it is now firmly rooted. Many complementary therapies have followed this path to acceptance into conventional medicine. The popularity of complementary therapy is rising in Canada as Canadians seek to improve their own access to substantive health care. In 2016, 79% of Canadians reported to have accessed at least one form of complementary care, with the top two modalities being massage therapy and chiropractic. Many popular forms of complementary therapy are already regulated under provincial and territorial regulated health professionals acts. Chiropractic is regulated in all the provinces, as well as the Yukon. Massage therapy is regulated in 6 and under review in a further 2. Naturopathy is regulated in 5 provinces, with limited ability to prescribe. Acupuncture and traditional Chinese medicine each have been regulated in 5 provinces and under review in a further 3. Complementary therapies have been rigorously researched, and through regulation, these providers are a cornerstone of many Canadian treatment plans. However, this is necessarily limited to the financial means of Canadians to access complementary therapies, which are unfunded under provincial and territorial healthcare plans. As every child with an allowance knows, there is only so much money to go around. Deciding where to allocate scarce resources is a challenge for any governmental agency. The opportunity cost of including one treatment option is the opportunity lost to include another. Determining whether a particular service is medically necessary is a challenging determination that has fiscal and political consequences. Careful cost analysis and cost effectiveness must be considered to best determine which treatments to fund. While it may seem counterintuitive to consider adding broader coverage of complementary therapies, research has shown that many such therapies are cost beneficial when compared to surgical or pharmaceutical interventions. An inclusion of complementary therapies may prove to be less costly to the healthcare system as a whole in the long run. As indicated earlier, the key stated objective of the Healthcare Act is to protect, promote, and restore the physical and mental well-being of Canadians. In simple terms, that it isn't just enough to keep Canadians physically alive, but their mental health and happiness is also important. Whereby conventional medical interventions are necessary to provide for the physical well-being of Canadians, it is often through the supplementary addition of complementary therapies that the psychosocial component of the patient experience is considered. Many complementary therapies have a robust evidence-based foundation and have been included in clinical practice guidelines for conditions such as chronic pain, osteoarthritis, motor vehicle accidents, and migraines. Patients with cancer, Parkinson's, and a wide variety of musculoskeletal conditions have all experienced an improvement in their quality of life with the addition of complementary therapy to their treatment plans. Sadly, these improvements in quality of life are predicated upon the patient or the patient's family having the financial ability to pay for these services out of pocket. Because of the lack of funding, complementary therapies are only available for those patients with the means of access. This represents a significant financial barrier to optimal health for a wide swath of Canadians. In summation, the spirit of the Healthcare Act is to provide for complete physical and mental health care to Canadians without significant financial barriers. Complementary therapies are a viable, evidence-based supplement to conventional medical models, which are included in many clinical practice guidelines. Furthermore, complementary therapies support not only the physical, but the mental well-being of Canadians in a biopsychosocial model of care, which provides holistic support to our patients. Given that many complementary therapies are regulated and provide effective healthcare treatment for Canadians, it is incumbent upon the policymakers to recognize their place in the Canada Health Act and remove the financial barriers which restrict access to care. Complementary therapies are covered under the Canada Health Act and should be included in insurable services provided. Thank you very much.